and welcome everyone to today's webinar, Launching the National Medigap Plan Finder, Training for Ship Counselors. We did provide training for directors, trainers, and other staff earlier this month, but today is our first training for ship counselors, and this training will be repeated on March 4th. So if you want refresher training, you're welcome to come back on March 4th. And I think it does not appear I have the ball, so if the producer or Sue could pass me the ball, I'll advance the slide. Thank you very much. So we're going to skip past this because we spent some time on WebEx functionality already. And here are your speakers. I'm Jenny Paulson from the Ship TA Center. But our primary speaker today is Brian Welch from CSG Actuarial. And the tool you'll be learning about today was created and is supported by CSG. So we're going to give an overview of the tool. That'll be my part. And then Brian will give a demonstration. And then we will have time for chatted questions that we can provide answers to. And we'll also go over some resources. So a little background on this tool. You're receiving access to it through funding from our SHIP National Technical Assistance Center. And we are housing a link in the password protected area of our website, which is, as you can see on your screen, shiptacenter.org. You do have to log in, and we will talk about how you get to the tool once you've logged in a little bit later. And this is a tool that's been in existence for a while, and actually it has been used by 11 ships over the past few years and comes highly recommended from those ships who've been using it. It's available in all states in Washington, D.C., though we do hope to have it available for Guam, Puerto Rico, and the Virgin Islands in the future. It's a possibility, but it unfortunately isn't there now. So there are several benefits to this. I know a lot of people are used to relying on paper listings of the plans, and I know that a lot of ships put great amount of effort into the paper listings. And so one advantage of this is that it is updated in real time with the latest plan information, which that can change over the course of a year. It also allows you to customize searches by various factors such as gender, age, tobacco status, etc. And it does have printer-friendly and email-friendly results pages. One thing people have liked is that it will display the future costs based on attained age for plans that are based on attained age. And there's excellent support for this tool. There's a help desk, there's videos, webinars. So when you're in the tool, there's a menu that prominently displays contact support. And you will need to contact CSG for help with the tool. Here at the SHIP TA Center, we're kind of the messengers. We're funding it and hosting it for you, but we're not the experts on the tool like CSG. So it is live on our site. It's our newest feature when you log in, and we're going to have a demonstration next and then a few slides after the demonstration. And so with that, I am going to pass the ball to Brian, and he's going to share his screen and show you how to use the tool.
Perfect. Thank you, Jenny. Share my screen here. So everybody should be able to see my screen now, and I'll switch over to our initial page here. So again, I appreciate everybody's time, and for those that took time to join us on this. For those of you that currently use the tool in the states that we've worked with previously, we certainly appreciate and love that you've kind of adopted our tools, and we hope that you've found them useful. So this probably will be a review for you. And for those that are new, that haven't used our stuff or have experience in using the online quoting, this really is just to give you an indication or an idea of exactly the capabilities of what you can do with the tool itself. And so the screen that you're seeing in front of you is the initial page, is the initial quoting page that you'll get to when you get into the tool. And this is what we call our demographics page. And this is where you'll type in the zip code, age, gender, and tobacco status of the plan you're trying to quote for. And so I've already pre-populated a zip code here, 68135, and we'll then provide the county and the city and state that you're running it for. As Jenny had mentioned previously, this will work for any state in the country. So everything from California to Maine, down to Florida to Washington, you'll be able to run quotes and do that for any valid zip code in the country. We also have every age you want it to do. So it's not just 65 to 75. It's any age from 65 all the way up to 99 plus. And so you can run any age associated with the beneficiary that you may be working for. Gender, female or a male, and then tobacco or non-tobacco. Those are pretty self-explanatory, just based upon the credentials or demographics of the beneficiary you're working with. This will provide exact quotes, and so it's not a range or an estimate. The reason we ask those initial demographics up front is it does provide exact quotes for that beneficiary. We'll also provide the plan associated with the that you want to run. So you can see I've defaulted this to plan G, but if you'd rather run a high G or a high F or an A or an N and what have you and so forth, it will allow you to view those other plans and options as well. We have a sort by feature here. This will default to price, and we'll get to that in a second, meaning that it's going to assort the results cheapest to most expensive. But if you'd rather see them by rating, so you could be working with a beneficiary that says he only runs an A-rated carrier, you can sort them by rating. Or if you'd rather just see them alphabetically, A through Z, that's also an option. And the last two items here, one is effective date. And this becomes important. We're going to run the effective date as of today, but let's say your beneficiary was going to become effective, say, April 1st. You'll want to change this effective date up to April 1st. The reason that becomes important is there could be a company that's changing rates between now and April 1st, and you won't see that new rate unless you run a future effective date. And so that just helps you provide a more accurate result to that beneficiary. And the last piece here, this is a household discount, and we'll get to more of this in a second, but if you just automatically want to apply that household discount to the rate, and that's that discount associated with there was two spouses applying for the same coverage. Many companies offer discounts associated with those plans. If you just right off the bat want to go ahead and include that discount in the rate, you can. And the last piece here is client or quote label. This is optional. It's not required. If they just wanted to enter, say, you wanted to enter a name. Say we're going to run this quote for a Mr. John Smith. Say you're going to print this off or email it to a beneficiary and you wanted to attach their name to that printout or email, you can do so using this client or quote label. But again, it's optional. It's not required to run the quote. So once I've filled out the demographics here of what I want to see, I would press Get Quote, and I went ahead and populated the results for us. And so we sorted by price, and so this is sorting the results cheapest to most expensive. So we're giving you every company that will be available for the demographics that you typed in. So in this zip code for an age 65 female non-tobacco plan F, I'm giving you every result associated with those demographics. And so we don't hide certain companies. We're non-biased. We don't represent any of these carriers. We're simply providing all the results and letting you work with your beneficiaries to find the best fit. Here's our company box, as we call it, which is the initial result. And you can see each company box is going to be different based upon the company. We'll give you the price per month and then the company name. And then below the price, we'll provide two different data points. One is the HH discount, and that's that household discount I just previously mentioned. And this can range from 7% to 12% to 5% to 10%. It's going to vary depending on the company and the state that you're running. Some states don't allow the household discount to be available, and so if something on here is not available, you won't see it. The next one down here is policy fee. This is not included in the rate. Because this is a one-time fee, it's not paid each month. We don't include it in the monthly rate. Again, if the company does not require a policy fee or what we call an application fee, or what you may refer to as an application fee, this will also not be there. So we'll hide that. This could potentially be completely blank, if there's no household discount and no policy fee. By extension, we also provide some additional information on the company, whether they have a parent company, if they're AM Best or S&P rated, we'll provide that. And again, that's not a rating that we provide, but it is a rating that those entities do have, and some beneficiaries ask about them, so we try to provide as much information as possible. We'll also provide years in the market, how many years they've been in the market, and the effective date of that rate. Essentially, when that rate went into effect in that state for that particular plan. And then lastly, for this company box, we'll also provide the rate type, which is either attained age, issue age, or community rated. Some states are community rated options like Arkansas, where all the rates are the same regardless of age. That's where we're highlighting that rate type. And I'll get to this attained age more here in a second, but we want to provide you what type of rate types that company or state would be in. The last two pieces with this company box here is the plan details and the company contact information. Plan details are what they are, what the button says it is. It's all the benefits associated with those plans. And so what this is showing you for both Part A and Part B Medicare, what the services are, what Medicare pays, what this plan or Plan F pays, and then what you or the beneficiary would pay. And this can also be printed by clicking this print button up here on the left-hand side and attached to the rates. But this then provides you, because it's Plan F, it covers $0 cost for all of that. So that's the benefits. And then we also have the company contact information. So if you are working with an individual that wants to go ahead and contact the carrier, they can click this button. And what this does is opens up a new page with all the company's contact information for every carrier currently in the market, where they have their customer support line. So you can provide them contact information in the event that they want to go ahead and contact that company directly. So that's our, what we'll call our company box here. Above the company box is our quick quote section. And you'll see that here. And this is if you wanted to quickly adjust the demographics that you're running. Maybe you want to switch the age from 65 to 66. You want to look at a different plan. Maybe I want to look at G or N. Maybe you're running this for two different individuals and you wanted to go do both male and female. You can go ahead and do that quick adjustment here above. You don't have to start fresh, brand new, with a brand new quote each time. We just allow you to quickly adjust it on the fly from the top level of the page. If you do want to just start fresh and just get out and restart from the beginning, there's a new button here in the top right-hand corner that allows you to go right back to that previous screen we were just on. On the left-hand side here, we do have our toolbar options, and this scrolls, so you can scroll here up and down as you see fit or as you need it, depending on your screen size. But what we do here is a number of different things, and I'll start at the top. One is the compare quotes. And let's say you wanted to take 2 or 3 or 4 of these plans and you wanted to separate it from the group. You didn't want to show them a list of 30 plans. Maybe they were interested in 2 or 3, and you wanted to highlight just those 2 or 3 to maybe email or print for that beneficiary. All you have to do is click this company name, and it turns green. So maybe we'll click the 3 here at the top. It's then highlighted the 3 that I've selected, and you can do this across plans. So maybe you want to compare a Plan F to a Plan N or a Plan G to a Plan B and so forth. You can do so using this compare option, and then all you have to do is click compare quotes, and it'll load you a new screen that looks like this. And what this has done is it's taken those 3 options and put it on its own screen. So I'm not showing 50 results anymore. I'm just showing 3 that can then be printed or exported to PDF. And so you can do that here using these 2 buttons. The PDF, if you say you wanted to attach it to an email, or the print button if you were going to print it off and hand it to a beneficiary. And to get back, all you need to do is click this back button to go back to the screen we were just on, or click this new button that'll provide you the new result or the new demographics page where we started to start the webinar. So that's our compare feature. To unselect them, you can click this X button, or you can just re-click the company name and the green goes away. The green is essentially meaning you've selected that option for a compare. Below compare features, we have the export options, and those are pretty self-explanatory. We have the blue print button here, and this just allows you to print these results just as you see them into a printer-friendly format and hand them the results just as you see them on the screen. We have the red export feature, and this just allows you to export it to PDF and attach it to an email. Again, just as you see it on the screen, it'll export it, the full results, if you wanted to share that out via email. Or for those that do like more data-centric data, and you wanted to see just the results dumped into an Excel database, for those that they prefer that version, we also offer that as well. And this will just dump all of these numbers and results into an Excel database that allows you to review that in an Excel document. Below export, we have adjust or view settings. And from here, we can do a number of different things. The first is expanded and contracted view. We're going to show you the results as an expanded view, which is what you're seeing here. But maybe you didn't want to confuse the beneficiary with certain features, or they were just interested in the price and the company name, and you wanted to show them a more simple result. You can uncheck that, and what it's now showing you is just that, a simpler view with just the price and the company name. If you were to export it with the simpler view on there, it does export with that simpler option. And so this is, again, just if you didn't want to confuse beneficiaries, or they had told you, hey, I just want to see the pricing, I don't want to see the extra fluff associated with it, you can do so here by adjusting that expanded or contracted view. And to turn it back on, you simply click expanded view, and it opens it back up just as we did previously. The green checkbox means that it's on, and when the green checkbox goes away, it means that it's off. The next button down is apply discounts, and what this does is it'll go ahead and apply this 7% discount or 5% or whatever the percent would be to this monthly rate. So when I click it, you'll notice that the rates adjust. The rates adjust, and there's an asterisk that shows up next to the rate letting you know that that's included. If you were to do it from the start, if you wanted to go ahead and apply that right from the quote page at the beginning when we typed in the zip code, age, gender, and tobacco status, when you ran the quote or the result, this would automatically be checked, and that's essentially what that does. And so you can uncheck it and check it by just clicking that button, and you'll notice that the rates will adjust and the order of the company will adjust associated with those rates. The next one down is annual rate, pretty self-explanatory. If you'd rather see the annual rate versus the monthly, we allow that. If they wanted to see more of the calculation on an annual basis in terms of an annual cost. The fourth one down is market analytics, and that's going to really provide a lot of robust information. And that's really broken down into 3 different charts. The first is going to be age increase data, and this is important to attained age policies. Attained age meaning that the rate will go up each year the beneficiary gets older. Issue age community rated meaning that it doesn't. At issue age, they're not going to increase costs based upon the beneficiary turning a new age. And so for attained age policies, we'll give you future outlooks. So if you're sitting down with the beneficiary and they say, okay, I like this state mutual plan, it's 122.29 today, but what happens when I'm going to turn 66, 67, 68, and so forth? We'll provide you those future outlooks. And so we'll show you, and this is specific to that plan and company and state. So if you ran a different state or looking at a different company, this will change, but it's giving you future outlooks. And so we really want to provide this data to you so you can answer those questions as you get them from your beneficiaries. We really view this as a market advisor tool, not just a quoting tool, because we're trying to give you as much information as possible, and you can provide what's important to that beneficiary, or depending on the questions they may ask, you can provide those answers. So that's age increase data. If this was an issue age or an attained age policy or state, I gave the example of Arkansas, all of their plans are community rated. This does not apply, and therefore this will be blank. There'll be nothing here just because it's not applicable. The second box here is increase history. And this will give you every time the company filed new rates and got them approved, the date that they filed and the percent of change, either up or down. For the state mutual plan, they filed new rates in July of 13, they went up 9%. And then in July of 19, they went down 15.9% for an average of a decrease of 3.4%. This will go back to 2010, which is when the government modernized the Medicare supplement plans. Many of the companies will not go back that far for a number of reasons. One is there's many carriers in the market today that have entered since 2010, so they would not have an increased history going back that far. And many have introduced what we call new paper or a new insurance company that they now provide or distribute their Medicare supplement plan through, and those will not go back to 2010. So many will not go back that far. Some do, but you'll notice that many of them do not. Some may not have an increased history at all, and that would mean one of two things. One is that it's a new plan that they haven't filed increases for yet, or it's brand new to that state, and therefore the company maybe has been around a while, but they're brand new in the state that you're quoting. The last piece here is market data, and this is this is NAIC data, and so the companies self-report this every year in April, and so in April this will update for 2019. So we're showing you 2018 year data here. And so obviously 2020 is not over, it just started, and so they won't report 2020 until the end of this year. And so we're looking at previous year's data, and again, that updates every April. The companies self-report this information themselves. So we're not gathering this or looking at their results. We're simply providing what the companies are reporting to the commission, and we're giving you 4 different features. Total lives insured, meaning how many lives do they have on the books. Total premiums earned, how much earned premium are they gathering in terms of the policy premiums that they're collecting, what are they earning on that. Loss ratios, and what this means is what they've paid out in claims. So they have a national loss ratio of 69%. That means for every dollar they collect in premium, they're paying out 69 cents in claims. And the last piece here is market share, just what their percentage of market share, how much the market they hold today based upon the overall scope and number of people that are in the market or currently enrolled in the market. And we'll provide you this both on a national and state level. So as you switch states, this state box will adjust depending on what that company is reported for that particular state. For a company like a Blue Cross Blue Shield that is only represented in that individual state, these numbers will match. For many of the companies that operate in multiple states, they will not. But again, not information that every beneficiary is interested in. It's not always information that is always needed. We try to provide you as much information as possible so that you can give the beneficiary as deep a look that you can. So again, that's our Market Analytics tab, and you can uncheck or check this over here on the left-hand side. The last option here is Select Plans, and this is for states and for companies that offer a Medicare Select option. And what I mean by that, for those that are unfamiliar with Medicare Select, is there are a handful of companies, it is not very popular, and not every state has them, where they have a Medicare option, Medicare supplement option that provides a network. And so these are Medicare supplement options with a network. If you do want those included in your results, you can click this Medicare Select or Select Plans indicator to include those in the results. That doesn't mean that if you click on it, every result's going to show up in it. And it's likely that if you click those, nothing will change because they're not very popular in the market. But for those, if there is a beneficiary that is interested in looking at it, we do provide those options. Most carriers do not offer Select Plans. And so you will not run into these majority of the time. And the last features here, one is the health questions. And so if you wanted to be able to filter or understand if you are dealing with somebody outside their guaranteed issue enrollment period, say they're 75 years old and they've had a MedSup for 10 years and they want to be able to see what other options are available, that individual would have to go through underwriting. And so you're trying to understand not just who's the best price for my individual, but who would actually insure or underwrite and approve my beneficiary. You can click this drop down here, and what this will do is provide all the health conditions associated with those individuals. And I can either search or scroll and select certain health questions or conditions that will be associated with that, those conditions. So I'll select heart attack just as an example's sake, and what this is showing me is it's showing me the heart attack, the look back period is 2 years, meaning for this state mutual policy, if they've had a heart attack within the last 2 years, they'd have to answer yes on the app, and therefore will be declined coverage. And so this really helps you not only filter based upon the results of price, but also based upon who actually would accept my individual. You can select multiple health conditions, multiple drugs. It kind of just allows you to narrow down those results to see if it would be beneficial for that individual outside their open enrollment period to go ahead and switch. And then below that, we also have filtered quotes. This would just really means if you wanted to only see companies that contain a household discount, or if you only wanted to see plans that don't have a policy fee, it's just a quick filter to include those rather than scrolling through the screen. That's important to your beneficiary. We will allow those quick filter options. So that's really the results or quotes here of kind of what's provided. I'll speak to a number of other different things here before I think we can open it up for questions. We do have a few different features here. One is an About Quote section. This really just provides you some more in-depth information about what we just went over. So it'll really repeat exactly what we just went over in the webinar. So it gives you an idea of exactly what you're looking at if you ever get stuck or you ever have questions, or, hey, I see this is on the tool and I want to understand more about that. You can click this About Quote section down here. Or we have a Contact Support button. And this allows you to contact us into our help desk with any questions or issues or concerns with the tool. That can range from, hey, I'm getting an error message when I'm trying to run a quote. Hey, I'm seeing this quote or this price and I have questions on what it means. Hey, I see this market analytic page and I want to understand more about it. Or, hey, I got a new computer and so something's off with the technology. I need help with that. Any range of those options, you can click this Contact Support option here. Or we'll go back to our home page here. It's also here. So if you were to click Contact Support, you enter in your email, your phone, your method of contact, your subject line, and then your message. And you can send that message in. Or you can give us a call. And then we can provide you help over the phone if you'd rather just give us a call to provide that support. So that's our Contact Support option. Additionally, kind of some other questions that we've gotten in the past, just to kind of answer for those that you may have. This is mobile friendly, so if you wanted to access this through your tablet, you wanted to access this through your phone, if you wanted to take your laptop when we're outside the office, wherever you have an internet connection, you can get access to this material. So there's nothing you download to your computer. There's no program or flash drive or anything like that you have to put onto your device. Anywhere you have an internet connection, you can get access to this material. We've also had a number of questions on exactly how we get this information, and Jenny may have mentioned this before the call. Currently, right now, we get this information directly from all the insurance carriers. And so all the carriers for every state provide us their updated files on a monthly basis. So those would be approved rates that are also available for sale. And then that's a key piece. We only include both approved rates and rates that are also available for sale. So they may be approved but not currently available for enrollment. We would not include those on the site. We only want to include those plans that are currently available for beneficiaries to actually access and sign an app up for. We also provide only open block plans. And so there are companies out there that currently have a Medicare supplement policy but do not accept new business onto those. We would not include those onto this feature as well. So it's just be currently plans that are available for current enrollment as of today. But the companies provide us the rates. We upload them in real time, and so rates will adjust pretty regularly. Not every state updates, and not every company updates every week, but we're loading in hundreds, if not thousands, of rates a month, depending on the month, as the market shifts. For those that know and that have been doing this a while, the market can tend to shift pretty rapidly from month to month, especially on a national basis. And so we're doing that for you, which is kind of the value of the tool, is we're taking that upon ourselves to provide this access to you so that you don't have to use an old rate charter file that may be a few months old and not have up-to-date information. By extension, this also includes new entrants into the market. So we've had a number of new entrants over the last couple of years and are expecting more this year. If a new entrant or a new company was to enter your state, that would automatically then be displayed on this tool. So there's nothing you have to do. You don't have to refresh your screen or clear your cache or do any of that to update the platform. This will update in real time associated with you just getting in and using the tool. So you don't have to worry about any of that piece as well. With that, I'll kind of open it up for any questions, or Jenny, I don't know if you have any more PowerPoint stuff to show anybody, but I'm available for any questions if need be.
Well, since you're sharing your screen, Brian, maybe now is a great time for us to go over some of the questions that were chatted that are particular to the tool. And then the slides that I have are about resources. So I think one of the questions that I saw was, this is a great tool to answer additional questions about Medicare supplements. Is this tool only for Medicare supplement quotes, or will this include Medicare Advantage?
So that's a very good question. We do have Medicare Advantage, and so that's more of up to the leadership that we worked with to set this up. If Medicare Advantage is a need, or they would like to include Medicare Advantage on here, we can do that. It will work. It will be the same data that you can get today through the plan finder that you can on CMS, but it can work in conjunction with this. And so that would really be up to you guys if that would want to be included.
Okay, I know from the SHIP National Technical Assistance Center perspective, we wouldn't do that without clearing it through the Administration for Community Living, because CMS offers the Medicare plan finder that has the Medicare Advantage plan. So at this time, we're only going to be offering the Medicare supplement, but certainly if anything changes, we'll be making announcements and whatnot. Okay, there was another question. How are the GIRs handled?
GIR. You wouldn't have any more information on what they mean by GIR?
No.
Okay.
The person who chatted that, if you could explain the acronym, we can give it another shot. And then somebody would like you to show again how to see the contact information for the plans.
Sure, absolutely. So right here it says company contact information. It's a black button here. If you click that, it opens up the document with all the company's contact information. That's alphabetically. So that'll be for every carrier that's currently in the market, and that will update. So as carriers enter the market, or maybe it's a new carrier, brand new to the MedSup market, that will update with their contact information as well.
Okay, and then someone else would like to see how to compare plans that are of different types.
Sure.
G versus N, for example.
Yeah, right. So we got our plan here, and so what we'll do is we'll click maybe we want to compare the state mutual plan, plan G, and maybe we want to run an N. So I want to compare the state mutual here, and let's switch over and run an N. So I'll just switch and now click N. It'll automatically load for me. I've got the other plans saved up here in the left-hand corner because I clicked the green button here. And let's say I want to compare, here's the State Mutual Plan N, or any rate, right? It doesn't have to be State Mutual, but we'll keep it in the same company family. I then click that, and now I've got both my Plan F and my Plan N here, and I click Compare Quotes, and we'll then load the screen here. On the left-hand side, I have my one plan. On the right-hand side, I have my other. And you can do any different combination. You can do multiple plans. You can do 10 plans. You can do 5 companies with 3 different plans. Any combination of that works.
Okay, thank you, Brian. And then just a quick reminder from me for people who might have joined a few minutes late. We are going to make the PowerPoint, the handouts, and the certificate of attendance available for download near the end today. We made everything but the certificate available for download at the beginning, and we will do so again at the end, and all of that is also in the SHIP resource library. And then somebody wondered how long this session is scheduled for. It's for 1 hour. So we have about 23 minutes left. All right, somebody said, can you choose multiple health conditions? And could you show how to do that?
Yep, so we'll choose heart attack, which is our example before, and maybe we want to choose stroke. So here's the result here. So here's both of them.
Okay,
so you
wonderful.
You can choose 10 if you wanted to.
And there is another question. Do you know if the companies offer other discounts, such as multi-policy like automobile, homeowners, etc., if the client also has that with the same company?
We don't have any beneficiary information in here, so you're not loading in any current beneficiary data from this. There's a multitude of reasons for that. One is we don't want to collect or store personal information or anything that we require as a HIPAA violation. So other than the zip code, age, gender, and tobacco status, we don't store or collect any of that data. That's kind of the main reason as to why we don't collect that. That may be a precursor to other coverage that they have. Additionally, for a Medicare supplement plan, I'm not aware of any plan that currently offers a discount associated with their P&C stuff. That if they have, a car insurance policy with a healthcare provider, that the healthcare is then cheaper. I'm not aware that those discounts exist. By extension, there are plans that offer innovative benefits, the dental benefits, silver sneakers, things like that. We will have those highlighted in the on the tools and in the plan details.
Okay. Someone asked, could you please tell us what are the different rating classes?
Sure. So the rating classes are going to be right here, associated with the tool. Many carriers do not have a rating class, and you'll notice that when you start getting into the features. There are certain companies that do. Those will be labeled differently depending on the carrier. It could be level 1, level 2 in United Healthcare's sake. It could be class 1. It could be substandard rating class. There are some carriers that offer higher rates for riskier pools or riskier individuals, and these would be available for people that are outside their open enrollment period, that they're not going to decline them coverage, but they'll move them to a higher rate. We'll provide what rating class those are associated with under this rating class field. Again, not every carrier, and a lot of carriers do not have separate rating classes, but some do, which is why we include that item line here.
Thank you. Someone asked, is there an enrollment function? And no, the tool is not intended or set up for actually enrolling. Beneficiaries would have to conduct enrollment themselves using the contact information. So let's see what else. There's some questions that I can answer with the slides coming up. Okay, so I'm going to pass over those just for a minute and stick to questions about the tool since Brian is sharing a screen. If you have someone who is only interested in comparing issue age-based plans or community-based plans, can we use that as a filter?
So not today, but I'll answer that two different ways. Not today. Most it's by on a state basis. So if I was to run Arkansas here or Missouri as an issue age state, most of them follow the state rules or footprint. And so most carriers, like I think I ran a quote from Nebraska, all these are going to be attained age because that's what the state allows. So it's not necessarily that huge of a need. But with that being said, we are constantly requesting or asking for feedback. And so if there are certain things like that, or certain things like, hey, this would be a really nice feature to add, we're constantly trying to update the tools and provide assistance to those that are using it. And through the states that we've worked through this over a number of years, we've actually done that a lot. They've provided feedback to us, and we've made updates to the tool. And so if you have different features or as you're using the tool either now or in the future that you want to see or you think that would be beneficial, you can click that contact support button here, and we're always willing and open to hearing that.
Okay, thank you, Brian. The GIR stands for Guaranteed Issue Rights. So how are guaranteed issue rights handled in the tool?
Sure. So, and this was brought up in the previous webinar that we did with the ship directors. Today, right now, we don't ask for their current Part B effective date or their current guaranteed issue status. And so how we've handled this in the past with other states that have used this then is they've had to understand if they're in guaranteed issue or not to know whether to use the underwriting portion of the tool. With that being said, and I had mentioned this on the previous webinar, and again, this kind of goes back to providing feedback on the tool. If you think that it would be beneficial or helpful to include guaranteed issue rules in the tool to help the counselors or yourselves understand if that person is within their guaranteed issue rights, that we can do that.
Okay, there's a lot of questions about access, so I will just say briefly, I do have slides on this, but the tool is only available through password protection. That's our agreement with the Administration for Community Living, our funder. So to access the tool, if you're not a state who has a different system because you paid for this on your own, if you are using the national tool, which is what we use grant funds to pay for, you will have to log in at www.shiptacenter.org to use the tool. And it's available to counselor level users and higher. And so if someone has an account that's just at the counselor and training level, what that means to us is they haven't necessarily been certified. So certified counselors need to be given a counselor level access in our website in order to access this tool and things like the resource library. Also, so somebody is saying they tried to use a URL without luck. That's because for all of you, you have to log in to our website first to be able to access the tool because it is password protected. And we have no plans to make this available to the general public as part of our grant. So we're just making a tool available for ship counseling purposes. Let's see. Somebody said in the last version, the name and phone number of the person running the quote appeared on the top of the results listing. Is that gone? I did not see that. Brian, do you know what that's referring to?
Probably referring to this client or quote label. They can include any label that they want to on the tool. So that would be in reference to this, that you can attach a quote label to any of the printouts that you do. It's not required.
So you would want to leave that blank if you don't want names in there.
Yep, you got it.
Okay, the next question is from Wisconsin. Wisconsin is a waived state. How are the plans presented with base rates and optional riders?
Great question. So we'll switch over to Wisconsin. So we're running a Wisconsin zip code here. So Wisconsin and Minnesota are different in that they don't offer plans A through N. And So what we do is you'll notice that rather than the plan showing G or L, it's now showing Wisconsin base. And so we'll go ahead and run this quote for the base plan, and then you'll be able to select the riders. And this only makes sense to people that are familiar with Wisconsin. Here are then the rider selections that you would make. So if you wanted to include, say, the 50% Part A deductible rider onto the rate, you click that, and you notice the rates update. And so this is where you'll make those selections for those individual states that are, again, Wisconsin and Minnesota, that are different.
Great. Thank you, Brian. There was, again, a question. I just wanted to reiterate that the tool is not an enrollment tool. It is a tool that filters for your options. So beneficiaries will need to contact the plans for enrollment. This tool will not do that for them. There's a question, how long are quotes effective?
Sure. So that's going to depend on the carrier. Most carriers will update their rates on a 12-month basis. That doesn't mean that it has to be right at 12 months. Some will extend it to 15 months. Some will extend it 2 years. But most are around that 12 months of when that rate will become effective. So majority of the rates that you would see are going to be within 12 months. For example, I'll pull up another quote here. You can see here all of these are within the last 12 months of the current date of when they were last updated or changed. And so, again, it's not going to be exactly the 12-month option. Some will extend it longer, but that's roughly what we see in the industry.
Okay. What if you have a health condition that excludes you from coverage completely? What result will it give you?
In terms of if you ran, I'll kind of answer that two ways. If you ran an age and a plan combination where that a company did not provide, it would not show in the results. So if State Mutual did not provide a Plan N and you ran a Plan N, it would not provide results. If you ran an under 65 option, so an ESRD or somebody that's under 65 and is enrolling as under a disability, there could be certain carriers that offer that and certain carriers that don't. We only show the carriers that will be available based upon the demographics combinations. That also is the same way with the state. So if State Mutual was offered in Nebraska, like this quote I just ran, but it's not offered in Arizona, you would not see State Mutual in the results for an Arizona zip code.
Okay. And then I know Brian demonstrated earlier using the health questions that it shows the look back, and then he mentioned, like with heart attack, you wouldn't be able to get that plan if you'd had a heart attack within that 2-year look back.
Correct. Yeah, you'd have to answer yes on the app, and then if the applications will say if you answer yes to any questions above, you would not be issued coverage. And so that's a quick way to understand the company and how they view certain health conditions.
And then where would it show if they offered additional benefits such as vision and dental?
Sure. So you'll find that in the plan details. So I'll run this quote again here for us. These are the plan details that we have. So this is where all the benefits are associated with these plans. And the benefits associated with each company or plan will be available under that plan details button. Ginny, I think you're actually muted.
Oh, sorry about that. Thank you, Brian.
No problem.
What I think I will do next is show the slides about accessing the tool, since there were several questions, and then go back to the chatted questions until we have run out of time. We will be saving all chatted questions to enhance our FAQs. And so with that, I guess if you just stop sharing, Brian, then I can take the ball.
Let me do that here.
Okay. All right. And now I have the ball. So just in terms of what is available, we have these materials. This slide shows you that we are featuring this tool on several pages on our website. There's a feature when you first log in. It'll look like the picture you see on the right. And then there's a quick link on that same page, and then there's a web page that has it. So this screen is showing you where to find the web page. If you click on the feature, maybe I'll just use my arrow here, you can see here there's a feature, new Medigap Plan Finder tool. If you open the feature, there's a link to the tool. But if the feature gets pushed out by newer features, you can go to the Medicare and Other Insurance menu, and then the bottom item on the menu is Medigap Plan Finder. Also in features, we have quick links, ship work shortcuts, and the second to the last one is the Medigap Plan Finder tool. So we provided access in multiple places. And this is the contact information. So here's the phone number for CSG Actuarial Support, their help desk. And then they have a online form for sending an email to support. And then our center, if you need help getting an account on our website, you can contact us at the email address or the phone number shown here. So essentially, to log in, you go to the website that's listed, and there is an orange ship login padlock near the top or at the top of the page. And when you log in, you follow the prompts to enter your email address and your password, and then you can go to the resource library to get the PowerPoint, any other handouts, and then the recording will be added tomorrow. Or you can use a keyword search. And I guess this is the last slide. So essentially, hopefully that answers people's questions about access. And so with that, I'm going to go back to this slide and see what other questions we have here. There are a lot of great questions. Thank you, everybody. Do you have an example of one of the plans that offers additional options such as silver sneakers where you could show an example? Does that sound familiar to you, Brian?
Yes, so that'll be under the plan details button. So if they click that plan details, that's where all the benefits associated with the plan and the company will be associated with. So if they click that plan details in there, it'll outline those different types of items.
Great. And then someone asked again how you compare prices by type across insurance companies, and that's that compare tool that Brian demonstrated.
Yep, you just click the company name and it turns green, and then it allows you to compare any different combinations that you want to do.
Okay. And then it said, is there documentation on how to use this tool, or just the online help showed today? We will have this recorded, and it'll be in our library. But Brian, did you want to talk about the types of support and tutorials and whatnot available within the tool?
Yes, so we have the FAQs that we created specifically for the ship counselors that kind of go over previous questions that we have gotten. We also have that About Quote section button on the tool that I mentioned during the webinar that kind of shows you each information and kind of outlines exactly what you're looking at in a more of an in-depth format, kind of encyclopedia review associated with that. And then last thing is we do have the Contact Now. So if you wanted to be able to provide feedback or assistance or questions, anything at all that you would have in reviewing the tool or results that you're seeing, you can always click that Contact Support and give us a call or shoot us an email, and one of our people here will be able to help you out immediately.
Okay. And I just want to mention to our WebEx producer, DJ, he's making the files available for transfer now. So those of you who weren't able to get the handouts and the PowerPoint and whatnot at the beginning, you soon will be able to in this file transfer that DJ is initiating. If you don't see a file transfer box, it would be because of settings on your computer that would be blocking the pop-up. So you would have to get them from our resource library. One of the questions is, in Massachusetts, we are called Shine counselors. Will we still have access to this website? Absolutely, because several of the ships across the country have state-specific names, but it's all the same funding largely, or the federal funding is all the same, and so it's the national name ship that we use here, just to be inclusive of all 50 states plus Guam, Puerto Rico, the Virgin Islands, and District of Columbia. All right. So how to log into the site confused? I'm going to, our WebEx host actually has to keep the ball because that's how the file transfer works. So I guess, DJ, if you would want to scroll to the next slide, and keep going, one more, I guess, actually. All right, this is a screenshot of when you're logged in to www.shiptacenter.org. What you will see, if you're a counselor level user, you can click on the feature, new Medigap Plan Finder tool. You can use the quick link that the magenta arrow is pointing to, or you go to the Medicare and other insurance menu, and at the bottom of that menu, there's a page for the Medigap Plan Finder. So if you don't have an account on our website, when you click that orange ship login padlock, which DJ, if you wouldn't mind scrolling down, we have a picture of the orange padlock on a subsequent slide. I think one more. Yes, there's a little picture of the orange ship login padlock, which you will see from www.shiptacenter.org. When you click that, it brings you to a login page. If you do not have an account, you can register for one. And then there will be a waiting period while an administrator or director in your state reviews your request and approves the request. We don't approve requests at the national level. That is handled by the leaders at each state. So I guess hopefully that answers that question. Okay. There's a question here. Can we get to your website via Medicare.gov? Well, Medicare does promote the ships, and they do have links to www.shiptacenter.org, or at least they used to. So that should be an option, but otherwise you could just bookmark our website address for simplicity's sake. Does the website time out, or can we keep it open for a longer period of time? It will time out. I apologize, I don't know how long it sits idle before it times out. I would think it would stay up at least 30 minutes. We are upgrading our website in March. So you should know that between March 23rd and March 25th, those 3 days, you will not be able to access our site. We are changing vendors, and to get the database transferred over, there will be at least 2 days downtime, but we're conservatively saying 3. So just FYI. I guess with that, we can go to the thank you slide, and this concludes today's webinar. Thank you, everyone, for joining us. You're welcome to come back March 4th if you have more questions and want to see this training again. And thank you very much, Brian, for your excellent demonstration.
Yes, thank you.